Who are you? Who are you? Who are you? And who do you think you are? Who do you think you are? That's right.
We made history this week. We all made history. For the first time in a very, very long time, we stood up and we empowered ourselves. And we said to that corporation that runs that hospital, we said, no, you are not going to continue to step all over us and our patients. We said, no, we are going to be able to take care of our patients. That corporation has been treating patients like numbers for far too long. We're at a point where we're going to tell them, no, we are not going to allow you to treat those patients like numbers. They are human beings. Treat them like they are. So here we are out today to come and show that hospital that's what we're all about. If we stay together, we cannot be defeated.
I am so proud of every single one of both of our membership for standing up and telling Bruce Cummings and his merry men that we are not going to take their crap anymore. We are here. We put quality in the care that we give. We are not just faces. We are the people that have the hearts. We're the people that hold your hands when you're sick. When your family is sick, we're there to comfort you and make sure you're okay. So the next time you're walking through that building and someone stops and says, do you need help finding something? That's one of us. That's all of us, because we're the ones that care. L&M doesn't care, its staff cares.
For all the houses here and all the surrounding southeastern Connecticut area, we know that the replacement workers that they got in there now can't hold a candle to any of you.
My doctor ordered blood work for me. It's on an L&M form to go to one of the clinics for blood work. Well, I went to Bacchus today, so...
This is not about corporate profits any longer. This is about the survival of the middle class, and we are done. We are all done laying down. For years, the middle class has given back. For years. And corporate profits in this not-for-profit hospital have gone up. No longer will we stand by and allow your jobs to be given away, your wages to be given away, so that the very top can be successful and we have to struggle. We are done giving back.
The work that you all do each and every day is God's work. The work that you do in this hospital, making sure that loved ones are taken care of, making sure that kids are okay, that our seniors, all the things they talk about as family values, that's you. And by the size of this crowd, the community knows it. And the whole community is in the house. And that's how you know you're on the right side. It's because of the turnout today. And so with this, understand that there are 220,000 union members in this state, and they're all standing here with you today.
So let us go forth into this battle, fortified by the knowledge that we are not alone, that our struggle is a noble one, that on this day, in this place, we stood tall, we stood together, and we said, this is my community hospital. I am L&M. And I can tell you that your fight is our fight, because we have a CEO who made $7 million last year while they're cutting first-line staff that works with direct care patients. So that's wrong. That's what's wrong with healthcare. So this fight is our fight, and we're next door, and we're here to support you anytime. Keep up the good work.
You inspire us. You inspire us by the work you do every day, taking care of these patients. God bless them. That's right, for the patients. Remember the patients? I think the folks here in the management here at L&M need to remember it's patients before profits. They got us mixed up somehow.
What a great afternoon.
And you know what? The sun is shining on all of us here right now. And if that's not a great sign for the success that you're going to bring to our community, that we're all going to bring to our community, bring back the community in our hospital and the community in the workers that work so hard to care for our families, our patients, our community.
Who are you? That's right. You're not a building. You're not a corporation. You're the people that take care of our loved ones. And I can't thank you enough for that. You are the people that beyond just the care, you hold the hands. You're the people between the doctor and the priest. Another name for you are angels. Every one of you. And I want to thank you for that. So shame on Cummings and shame on the board of directors, because this is your hospital. These people here, not that building, you. And thank you very much. I'll tell you one thing you have. You have heart and you have courage, because what you're doing today and what you're doing this week is going to define the state of Connecticut and the labor movement. You have shown us more courage. You have shown us big burly building trades guys how to do it.
That's how shameful it is that a hospital that is supposed to care about the community has turned its back on the community, has turned its back on the workers. When they're supposed to care about people, they care only about one thing. You know what that is? The bottom line, that's all they care about, and that's wrong. That's wrong for hospitals, and it's happening across America, and there are people who are saying, we're going to stop it, we're not going to take it anymore, and you know who those people are? Yes, we are! Today may be Black Friday, but here in New London, it's Labor Day! You're not looking for money. You're not looking to raise your pensions. All you want is a voice and dignity. And security. Yes! And we will be here till we get it done.
The hospital behind you is a not-for-profit, which means that all this land in our very small city is off our tax rolls. Every taxpayer in our city, to the tune of millions of dollars, subsidizes our not-for-profit community hospital. And how have they behaved? With 200 million or 200 days cash on hand, with millions of dollars in Cayman Island bank accounts, attesting to the state of Rhode Island about their great financial health, so that they can buy Westerly Hospital, so they can open new cancer centers, so they can buy more property in our city. They have plenty of money to invest in buildings. We want them to invest in our communities. You know, a couple months ago, when this began, the hospital came to me and asked if they could rent Ocean Beach so that they could park replacement workers there. Well, they underestimated you, but they also underestimated New London, because New London is a union town. New London knows how to fight back, and I told them to take a hike. New London doesn't stand with scabs. New London stands with our nurses. New London stands with our technicians. New London stands with our healthcare providers. All of New London stands with you, because New London is L&M. We are L&M. We are L&M.
Because I know you want to be in there working, right? You want to be in there taking care of patients. That is what you do, as well as any hospital in the United States of America. The nurses and everybody out here are great healthcare providers, and I am so proud to be with you today. so proud to be with people who take care of other people when they need that care the most. There is no place for lockouts. There is no place for lockouts, and I want to make sure that you are back on the job, providing the kind of health care that makes us proud, under conditions and terms that are fair to you. That's all you want, right? Is fairness and justice. And I believe we can do it. You should never feel that you are alone. I am with you. Connecticut is with you. America is with you. Keep the faith. Thank you so much. God bless you, and God bless America.
It says on all these signs, unfair labor practice strike. Now, what does that mean in English? Sorry, I'm a social studies teacher. It means that under the law, they did something they ought not do. And therefore, if they don't negotiate, we have no choice but to try to actually tell the community what's going on. That's what an unfair labor practice strike means. This is not a strike for wages, even though the wages should go up. This is a strike for one thing. And the mayor said this to me before. I was very taken by this. Everyone, and I grew up in a community like this. I grew up in Nyack and New City, New York. Nyack Hospital. Everyone in Nyack, my mother was a school teacher there for 30 years. Every person in Nyack was connected to the Nyack Hospital, one way or the other. Either was born there, had, God forbid, family members who had surgery there, who had passed there. Everybody was connected. That's what this hospital, LMN, have been. That's why we're all saying, I am LMN, you are LMN, we are LMN, because we're all connected to the proposition that the nurses work really hard every single day, going well beyond what their technical ability is to really be a soulmate, to be a spiritual connection, to help families in great time of stress and great time of need. What the hospital does is to say, we are in the community to provide patient care, to heal the community, to be part of the community. That's what this hospital has always stood for. And that's why the nurses, the doctors, everyone go well and beyond. And that's why the hospital in New London have been the same. They have broken that covenant. They have broken that social contract. Frankly, most people in New London didn't know that. Most people in Connecticut didn't know that. Nobody wants to be on strike, but if you are not being fair at the negotiating table, what is a worker supposed to do? So, that's what it's about. It's about fairness. It's about quality care. It's about making sure that this hospital doesn't betray its promises to the New London community about when it says it is about care, that it has to mean it's about care. That is why the governor supports you. That is why your mayor is here every day.